The streets of the rural village of Yatar in southeastern Turkey are filled with children. Families here often have more than 6 children. And if wealth were measured by the number of children, women in this predominantly Kurdish town would be rich. Like 59-year-old Fatma Koç, who had all 9 of her children, ranging in ages from 40 to 20, in this living room. Instead, Fatma, like the vast majority of women in this remote region, is poor, uneducated, and suffering from untreated health conditions.
I have pain in my bones. I am in pain, and I have suffered for a number of years.
Did you see the doctor?
There is no doctor. If I am sick, I have to go somewhere else.
How is your health?
How is my health? I have pain.
Do you know the problem?
No, I didn't go to the doctor for 1 year.
Didn't you go?
No, I didn't go.
Fatma Koç isn't alone. Southeastern Turkey is one of the poorest regions of the country. When the women who toil in cotton fields need someone to examine their aches and pains or birth their babies, it is impossible to find a doctor in this rural area, especially one who speaks Kurdish, their native language. Even in Diyarbakır, the region's largest city, things aren't much better. The lack of development and affordable clinics have created a dire health situation for the more than 1 million people living here along the banks of the Tigris River.
In the West, people go to hospitals 4 to 5 times a year, but here, no more than 2 times. The health conditions of Diyarbakır are much worse than the rest of Turkey, in almost every way.
This ancient city has been decimated by years of ethnic conflict with the Kurdistan Workers' Party, or PKK. Recently, the ruling AK Party has funneled billions of dollars into the region for both votes and economic development to counteract the influence of the PKK. And health is a priority.
We made a lot of investments in health. We've modernized our health systems. General doctors and specialists are required to give care. For this reason, right now, the number of doctors per patient, we're on the same level as other regions in Turkey. In fact, we are better than most of the other cities. Diyarbakır became the healthcare center of the region. For the poor people who don't have health insurance, we are providing health care and medicine for free.
One of the outcomes is this free clinic, one of the few of its kind. This is good news for Saliha. She is 8 months pregnant with her first child, and she can't afford to go anywhere else.
We came here because we don't have money.
Doctors at the clinic offer prenatal checkups, and about half of their patients are women and children. They also offer basic health care for residents suffering from cholera, diabetes, typhoid, or hernia like this man.
Most of the patients come here as a last resort when things are at their worst.
And since more than 8% of the families living in Diyarbakır have no income, medicine is free. And one of the biggest pluses is that most of the doctors at this clinic speak Kurdish, a language that Turkish authorities restrict in public. The language barrier has particularly affected women.
Most of our patients are women and children. In Diyarbakır, the ratio of our educated female patients is less than 1%, and half of the female patients speak only Kurdish. That's the main reason why they come here.
But unfortunately, clinics like these are largely concentrated in the city. Far away from Diyarbakır, women like Fatma, who depend on unreliable agricultural income, cannot always afford to make long treks into the city. Fatma has lived in this desolate village all of her life, and given the health situation in southeastern Turkey, she is worried that she will probably die here too.
The doctor said I need an operation. He gave me some medicine and told me to come back. But I couldn't go. I don't have a car, and the shuttle is too expensive.